Let me warmly welcome you to today's discussion about an important health topic that affects many patients. How to tell the difference between common gallbladder pain and more serious cases needing immediate medical care. We'll be drawing from an article by Dr. Rajarshi Mitra, a laparoscopic surgeon and proctologist practicing in Abu Dhabi, UAE, as we help you understand key symptoms and recognize when it's time to get professional help. Let's start by getting to know the gallbladder, a fascinating organ that's crucial for digestion. This small, pear-shaped organ nestles beneath your liver in the upper right abdomen. It stores and concentrates bile, a vital fluid made by your liver. When you enjoy fatty foods, your gallbladder contracts, releasing bile into the small intestine to help break down those fats. What actually triggers gallbladder problems? Two main culprits are usually responsible. The most common are gallstones, hardened deposits that can range from tiny sand-like particles to masses as large as golf balls. Then there's biliary sludge, a thick mixture of bile and cholesterol that can block normal flow. While less frequent, infections or tumors can sometimes cause gallbladder complications too. The important thing to know is that these issues typically arise when bile flow gets blocked or the gallbladder becomes inflamed. When we look at gallbladder pain, we see a range from mild discomfort to serious emergency situations. Pain intensity acts as a crucial indicator of how well your gallbladder is functioning. Understanding this spectrum helps determine whether simple lifestyle changes will do the trick or if you need immediate medical help to prevent complications. Think of it as your body's warning system, helping both you and your healthcare providers make the right treatment choices. What does typical gallbladder pain feel like? While it's usually not an emergency, it can certainly be uncomfortable. You'll typically feel it in the upper right abdomen below your rib cage, and it might spread to nearby areas. It usually shows up as a dull ache or pressure that comes and goes, especially after meals and during the night. Now let's talk about the warning signs of severe pain that shouldn't be ignored. Unlike milder cases, severe gallbladder pain often begins in the upper right abdomen but can spread to your back, shoulder, or chest, making it tricky to locate precisely. The pain feels sharp or stabbing, and unlike mild cases, changing position doesn't help. Most importantly, this pain tends to be constant rather than coming and going, and it might start suddenly, lasting for hours or even days without letting up. Several other key symptoms need careful attention. When your temperature climbs above 100.4 degrees Fahrenheit, or you experience ongoing nausea and vomiting, these are serious red flags. If you notice your skin and eyes turning yellow, jaundice, or your urine becomes dark while your stools turn pale, this suggests problems with bile flow. Any of these symptoms usually means you need immediate medical evaluation. Let's explore what's behind severe gallbladder pain. 4 serious conditions typically cause intense discomfort. Acute cholecystitis happens when gallstones block the cystic duct, leading to inflammation. With choledocholithiasis, stones move to block the common bile duct. Cholangitis shows up as a dangerous bacterial infection in the bile ducts. And if the gallbladder perforates, it can cause a life-threatening abdominal infection. Each of these requires immediate medical care. Here's how to tell the difference between common and severe gallbladder pain. Common pain usually feels like a dull ache or mild cramping that comes and goes after meals. Severe pain, however, is sharp, stabbing, and persistent, often lasting for hours or days regardless of eating. While both typically occur in the upper right abdomen, severe pain tends to spread more widely and brings along worrying symptoms like high fever, jaundice, and changes in urine or stool color. Understanding these differences helps you know when mild discomfort has become something that needs immediate medical attention. Let's walk through how doctors diagnose gallbladder problems. They start with a careful patient history and physical exam, checking your symptoms and looking for tender spots in your abdomen. Blood tests help spot infections or bile duct issues. Ultrasound is the main tool for finding gallstones and inflammation. In more complex cases, advanced imaging like CT scans, HIDA scans, or MRIs give detailed views of the gallbladder system. For managing common gallbladder pain, several conservative treatments can help. The foundation is dietary change, switching to a low-fat diet, staying away from trigger foods, eating smaller meals more often, and getting more fiber. When it comes to pain relief, over-the-counter NSAIDs like ibuprofen can handle mild discomfort, while your doctor might prescribe antispasmodics or stronger medications for more intense pain. In more serious cases, medical intervention becomes necessary. When gallbladder pain turns severe, hospital care is often needed to prevent life-threatening complications. Treatment usually starts with IV antibiotics to combat infections like cholecystitis. Many patients benefit from an ERCP procedure to remove gallstones blocking the bile duct, while laparoscopic surgery remains the preferred method for removing the gallbladder. Some complex cases might require traditional open surgery, though this means a longer 4 to 6 week recovery compared to just 1 week for laparoscopic approaches. Let's be clear about when you need emergency care. Never ignore warning signs like severe abdominal pain, fever above 100.4 degrees Fahrenheit, yellowing skin or eyes, persistent vomiting, dark urine with pale stools, or mental confusion. These symptoms mean you need immediate medical attention. Don't delay. Get to the emergency room right away, as early treatment can save lives. Managing your gallbladder health comes down to understanding key differences. Common pain tends to be mild and intermittent, often showing up after meals, and usually responds well to lifestyle changes. Severe pain is an entirely different matter. It's intense, doesn't go away, and when it comes with symptoms like fever or jaundice, it's a genuine medical emergency. Don't take a wait-and-see approach if symptoms get worse. Quick medical evaluation can prevent complications and help you stay healthier. A final important note. This information is meant for educational purposes only and isn't a substitute for professional medical advice. Always check with your healthcare provider about medical conditions and treatments. In emergencies, contact medical services right away. Remember, this information doesn't create a doctor-patient relationship. Thank you for watching this video.